New studies show social distancing might have flattened the COVID-19 curve in some places. According to a May 27 research letter in JAMA, hospitalizations in 4 states with stay-at-home orders were well short of the projected exponential growth curves. The study is based on 4 states: Colorado, Minnesota, Ohio, and Virginia. About 8 to 10 days after stay-at-home order, cases began to decrease. In a separate Canadian study measuring COVID-19 patients occupying ICU, the same conclusion was reached. Based on their model, which assumes 70% reduction in physical contacts for March 19 to May 3, they showed 2.0 cases per 100,000 population with physical distancing and 37.4 per 100,000 without physical distancing. Deaths among ICU patients were projected at 2.5 per 100,000 with distancing and 12.7 per 100,000 without intervention, which means social distancing did have an impact in slowing down the coronavirus pandemic. However, as cities and states reopen, there is a fear that relaxing social distancing might lead to a rebound. We could see second waves or second peaks. Continue to observe social distancing, wash hands, wear face masks, please seek care if you have cough, fever and shortness of breath. Thank you for watching ScieHeal, where we strive to democratize science and health. Subscribe and share.